Malo lele, talofa lava, kia ora whānau. I hope you're doing well. With Auckland remaining at alert level 3, I thought I'd bring a very special guest on the show today. Dr. Richard Hulme, a well-known doctor, health professional within our Pacific community, to talk more about the level 3 restrictions and guidelines for our Tamaki Makaurau whānau. Welcome on the show, Dr. Richard.
Hi, everyone.
You might be on mute, Dr. Richard.
No, I'm not.
Let's get into it. Richard, now, with Auckland remaining at alert level 3, can I get to see, as a patient, can I get to see a doctor during level 3?
Yes, you can. So what we don't want people to do is to be afraid to come in. It is safe to come in to see your doctor. And obviously what that looks like is someone will check to see how safe it is for you to come in or whether you should stay in your car. But what we want people to know is that we're taking all the precautions necessary to make sure that they are safe, because the feedback I'm getting from patients is they're scared to go to the hospital and they're scared to come to the GP. But we want people to know that we screen at the front door to see if someone's got symptoms, we'll say, go back to your car, all right? If someone doesn't have any symptoms and it's unlikely it's COVID and that you are safe, then we're happy to see you face to face. But that may be first, there may be a telephone consult first just to be sure, right? So we want people to know what it looks like, right? It's similar to what we did in level 4, where we'll do a telephone consult first, or telephone call first to see what's going on, and do we need to see you, or how much of that can we do just over the phone? So, for example, someone might want some medication, someone might want a lab form for the laboratory to do their usual blood tests. We can send the prescriptions straight to the chemist, so they don't even have to come in to our building, right? We can send the laboratory forms straight to the laboratory to lab tests, again, so you don't have to come in. So we have those little tricks, if you like, that make it safer for you to get the services that you need.
Ngā mihi, Richard. And for our whānau, our ainga, families and members of our community that haven't been into a medical clinic during lockdowns level 2 and level 3, how different will it be?
Well, probably no different to what they've seen in the past if they've come in before. But what we do know is that Delta is different from the earlier strains of COVID. So in the earlier strains, we would have plastic screens around the clinic, and we would separate the clinic into those who have problems with their breathing, separate from those who are well. But we know with Delta, those screens don't work. So our screening has to be at the front door, because we know that it's hard to get the virus if we're doing things outside. So if we see people in the car park, it's safer for everybody, safer for the patients, safer for other patients that are waiting their turn, and safe for our staff, right? So yes, it does look different because of Delta, but your safety is our priority. We don't want you to delay coming in. And I'll give you an example. I was just reading a case of a 20-year-old girl, Tongan girl, who recently had a problem with her eye. And she was losing her eyesight, right? And I think probably what was happening was that she was too scared to come in earlier, right? And the eye condition got worse, right? So that's how much fear people have about coming in to see the doctor. They're really scared. But we don't want you to be scared. We want you to be reassured that we are doing everything to keep everybody safe, What we don't want is people to delay getting the right treatment at the right time. If you've got an urgent problem, if it's that bad, we will send the ambulance to your house. And I did that the other day. I had a young man who was only in his 30s, but he was clearly having heart attacks. Not one, but probably at least 2 to 3 per day for a couple of days.
Wow.
Excuse me. So I sent the ambulance to his house. All right. He didn't have to come in to me. I rang the hospital, told them, hey, this man's coming in to see you. And I rang the ambulance and said, hey, this man's not here with me right now. He's at home and this is his address. So healthcare doesn't always need to be delivered in the clinic. We have online service called BETTR, right? BETTR. Okay, that's not the real Palangi way of spelling it, but BETTR for short. And if you just Google that, you'll find the way it's spelled. It's slightly different. But that way, if you're an enrolled patient, you can get the service online as well, right? So we've got more than one way of delivering healthcare these days. We have the online one where you can do like a video call, just like what we're doing now. Lorenzo, have you got something on your face there that I can see, right? Sort of thing. So we can do the online stuff, right? But we can also do the telephone stuff, all right? And what we want to do is to say, hey, what's the safest way to see you? What's the best way to see you? What's the best care that you need?
Richard, you mentioned that our ingas, our whānau are scared of COVID-19. And as a member of the community, how do I know that I will be safe from the Delta variant when I am in clinic?
Well, that's a good question. We can take every precaution, right? So the first thing we want to stress is that, have you had your vaccination against COVID, right? Because as you're hearing on the news at the moment, if you've had the vaccine, you're going to be safer than if you haven't had the vaccine, right? One vaccine saves your life. 2 vaccines will keep you out of intensive care or ICU, all right? So having the vaccine is really important if you want to go anywhere. One day you'll be able to fly back home. And if you haven't been vaccinated, you won't be able to go back home. And I tell you what, I'm missing going to Samoa, that's for sure, all right? So I'm vaccinated already. I've had my 2 vaccines. When those vaccine passports come out, I can't wait to see my family in Samoa, all right? So getting the vaccine is important because no matter where you go, whether you're going shopping, whether you're coming to the doctors, you're going to be safer, right? So that's the first layer of protection. Have the vaccine, all right? The second thing is wear a mask, all right? Wear the mask and make sure you cover both the mouth and the nose, not just the mouth. Forget about your nose, all right? Because remember, the virus can go up your, so I shouldn't do those things, it can go up your nose, all right? But it can also go in your eyes. So if you can, wear some kind of sunglasses to protect your eyes as well. Now, ideally, it should be like swimming goggles, so it's sealed, all right? But that's not always practical because everyone's going to look at you funny, right? But at least if you're wearing the sunglasses, it stops someone spitting in your eye because the virus can get in that way as well. Now, that's one thing that you see a lot of workers, they're wearing the mask, but they're not wearing the eyewear. But if you see the health professionals, they're wearing the shields, all right? Because they know to protect the eyes. So the best protection, make sure that you're wearing some eyewear plus the mask. Try to keep the 2 meter distance if possible. 4 meters is better, but 2 meters is possible. Don't forget to wash your hands, all right? If you've got any symptoms, get a test, all right? And I think those are some of the things that you can do no matter where you go. But when you come to see us, we'll also check to see how safe you are to come into the clinic. And you may have your temperature checked as well, right? As well as asking the questions, what symptoms do you have? So we take this very seriously around what's safe for you, and how do we make sure that you're the safest no matter where you are. But it starts with getting the vaccine.
Richard, you mentioned that local doctors offers an online service called Beta or BETTR. Can you just confirm if that service is available to local doctors, patients only, or is it open to anyone in the community?
Good question. It's open to everybody. But obviously, if you are an enrolled patient with local doctors, it's going to be cheaper. Just like when you go to any doctor, right? If you go to your usual doctor, you pay a cheaper fee. But if you enroll with the local doctors, and then you're a registered patient with local doctors, you'll get the cheap rate, right? So it's always going to be cheaper if you're a registered patient. And that means that local doctors is your family GP.
No, I'm here, Richard. Now, is there any other message that you would like to share with our patients and members of our community during this time, Whakamole, Richard?
Look, I think it's a very stressful time for a lot of people. A lot of people don't want to go to the beach, they want to go back to work, right? That's the thing that I'm hearing a lot of at the moment. And it's very stressful. I think the important thing is to reach out to somebody if you're struggling. Don't be too proud, right? No one likes to admit that they're struggling. That's why we have our pastors, right? We're very lucky that we have a church community, right? Reach out to somebody in your community, whether it be someone through the church, that might be going to get some parcels from South Seas even, all right? We're all in this together. It's not about which company do you work for? It's about where can you get help, right? And reach out. I think don't suffer in silence. You know, our people are very proud. You know, they won't admit that they're really struggling to put food on the table, right? Because it's just how we are, all right? We're very proud people. We're proud of how we dress. We're proud of how we eat, you know, especially when it, you know, I mean, we're not doing as much visiting now, but you know, it's food is a very important part of our culture. And you know, if we have visitors, you know how it is. We like to spoil our visitors, don't we? Whether it be a minister or anybody. But you know, people are proud. People may be embarrassed about not being able to put something out for their visitors. Simple things like that, but it means a lot to our people. So I think reach out. There's a lot of stress around and people can get very short-tempered. Kids can get really naughty because they're scared. They're tired of being, you know, locked down, feeling like a prisoner in their house. I mean, everyone sort of wants to get out of their house sometimes. You know, we've been doing it for, what is it, 7 weeks now? A long time. I feel sorry for those Australians in Melbourne, is it? They've got this. It's been like 256 weeks straight now. the worst country in the world for lockdowns, Melbourne, I believe. So, yeah, imagine how they're feeling. But yeah, I think it's a very stressful time. But reach out, check in, phone, contact your family, make sure they're all okay. Again, they may be too proud to say anything. But what we want people to know is that it's safe to come to the doctors. Don't delay in getting the right treatment, right? Don't delay. We want you to come in.
Ngami, Richard, I commend the work that you and your team at Local Doctors are doing for our community under, you know, this lockdown. So thank you so much. How do I find out more about getting access by healthcare during level 3 for Mole, Richard?
Well, there's a couple of places you can go to. The first is the local doctor's website. So if you just Google local doctors, the website will show you, you just enter in what suburb you're in, and the website will show you which is the nearest local doctor's clinic to you. When you look at the website, you'll see some are green and some are red, right? The green means that's where it's safer to go. So we want children to still get their childhood immunizations, right? Very important to still get those. And so if you go to a clinic that is a green one, then that's a safe one to go to. If you see the one that's red, that means they're the ones that are seeing those who have got coughs and runny nose, that sort of thing. So you may not want to go there if you're well, all right? But if you are unwell, then we want you to go to any clinic and they will direct you to the most appropriate place to go to, all right? So localdoctors.co.nz, and the other one is covid19.govt.nz. That's the Ministry of Health website, and you'll be able to find information there about where can I get a vaccine, what can I expect if I have the vaccine, because there's a lot of misinformation about, the vaccine is like having metal in your body and the sort of rubbishy comments like that. You'll get the right information, and there's also the healthline number as well there, so that you can get any advice if you're feeling unwell.
Ina ka wakalevu whawtaitele lava, meitaki maata Dr. Richard Hulme from Local Doctors. All the best to you, Richard, and your team, and hopefully we'll have you on the show in the near future. But thank you so much for coming on the show to share and Talanoa and kōrero with our community. God bless you, Dr. Richard.
E whamanuelea tui ati oi, and ele a whaina. Tā soifua.
Sorry for ya. I will leave you with Dr. Richard Hulme's words. He says it is not about which clinic or which company, which organization that you are registered with, but we need to stand together as one community, as one people, collectively, to fight against COVID-19. For more information, please visit their website, covid19.govt.nz, to make a booking for your vaccination. Take your whānau, your ainga, to get vaccinated to protect yourselves, our community, and our beloved Aotearoa from COVID-19. Vinaka vakalevu, mode.